Hi guys, it's Miss Weems. We're going to talk about schizophrenia today. So let's go through, okay? All right, so schizophrenia, okay, oops, sorry. It means split from reality through disorganized thinking, disturbed perceptions, and inappropriate action or emotion. So about 1 in 100 people develop schizophrenia. Average onset for men is age 18. For women, it's usually by 25. Men tend to have a more severe form of schizophrenia. Sometimes it comes on very sudden, sometimes it comes on very slowly. This is considered a psychotic disorder because people tend to have a loss of reality. Like someone can have OCD and still very much be aware of what is a real and what is real around them. Schizophrenia tends to have this dislocation with reality. So this quote below came from someone who has schizophrenia, who was talking. And they said, "This morning when I was at Hillside Hospital, I was making a movie. I was surrounded by movie stars. I'm Mary Poppins. Is this room painted blue to get me upset? My grandmother died 4 weeks after my 18th birthday." So you notice there's no continuity in their thought pattern. So again, this is also someone who has schizophrenia, is not medicated, but this is this break from reality. So as you can see, the thought process of someone with schizophrenia, it tends to be fragmented and often contains false beliefs or delusions, like thinking there's Mary Poppins. Okay, so delusions are beliefs that are not true. Hallucinations are sensory items that are not true, like seeing, hearing, feeling, tasting, smelling something that isn't actually there. Most hallucinations are auditory. Not everybody who has schizophrenia has auditory hallucinations. Okay. People with schizophrenia also don't have selective attention, so they're not really good at focusing in on one thing at a time. So like when you're in the classroom and you're listening to me, you're not looking at that brightly colored thing over on the other side of the room or the fact that somebody dropped their pencil. It doesn't completely and totally keep you from focusing on me. People with schizophrenia don't have selective attention. They often have what's considered inappropriate or diminished emotions. So what I mean by that is they could laugh when others are crying in a situation that would normally cause them to cry. They laugh. Or when they should be laughing, they start crying. Or they have what's called flat affect, which is when they express no emotions whatsoever. Okay, and their motor behavior sometimes is inappropriate. What that means is they could have senseless rocking, compulsive actions, or they exhibit what's called catatonia. Catatonia is when someone gets into what's an incredibly uncomfortable position that would obviously make a limb or fall asleep, and then they stay that way 4 hours. And then they get super agitated, jump up and run around, when before they wouldn't move for hours at all. So, and obviously different types of schizophrenia have different symptoms. So we're going to talk about what that means. Okay. So schizophrenia patients who have positive symptoms. So positive means the presence of inappropriate behaviors. So they have the hallucinations, they have the disorganized delusions, and they have the inappropriate emotions. They laugh when they should be crying, or they cry when they should be laughing. Okay. Okay. So schizophrenia patients with negative symptoms have the no emotional reaction whatsoever, the flat affect. Or they might have catatonia, which again is not moving for hours on end. So negative, loss of appropriate behaviors. Positive is the addition of inappropriate behaviors. Okay. So people who have a chronic form of schizophrenia, it's very slow developing. Men usually have the negative symptoms of schizophrenia and usually have the chronic form. The positive symptoms of schizophrenia, these up here, are the ones that are usually most easily treated with medication. Okay. So let's look at some subtypes of schizophrenia here. You got paranoid schizophrenia. This is when their auditory hallucinations and their delusions tend to have a central theme, and they focus around people being out to get them being persecuted, or there's conspiracy against them. Okay? Also, paranoid and schizophrenia tends to have a later onset time than the other forms. Okay, disorganized schizophrenia, the hallucinations and delusions are less pronounced, they're less obvious, less intense, but they do impair their ability to perform daily functions. Their emotions are impaired, so you have some of those flat affect, and they have difficulty communicating. So their hallucinations and delusions don't have any central theme around them. They change, but it impacts their ability to like try to do anything. Same with paranoid schizophrenia as well. But they lack they tend to have flat affect emotions, or their emotions are all over the place, and their communication is impacted. Okay, catatonic schizophrenia. They will get into that catatonic state where I talked about getting in a really uncomfortable position and then not moving. And they'll stay that way for hours. Okay. And undifferentiated schizophrenia, they have the symptoms of schizophrenia, but not anything specific enough to put them in one of the other three categories of schizophrenia. Okay. All right. So let's talk about subtypes of schizophrenia. Okay. So chronic or process schizophrenia is gradual or slow development of the disease. So this would be one of the earlier types we talked about, but it's a slow onset. And they usually have a long history of other mental disorders. And chronic or process schizophrenia, it doesn't become residual. In a residual form of schizophrenia, the symptoms can be dulled, it can be easier to live with, it can be something less pronounced. When schizophrenia comes in slowly and gradually with a history of other mental illnesses, it's much more difficult to treat. Acute or reactive schizophrenia, again, is fast appearing, shows up really quickly, usually responds to a very stressful situation someone was placed into, and with treatment and therapy, this can become residual schizophrenia, which is any of the other types, just one that is less pronounced, less obvious, and can gradually fade with treatment. Okay, so let's look at the different perspectives and how they deal with schizophrenia. So from the biological perspective, we have noticed that people with schizophrenia have an excess of dopamine receptors. So their hypersensitive dopamine system may intensify their brain signals, creating some of those positive symptoms that we talked about, hallucinations, delusions, etc. And drugs that block dopamine reception tend to lessen a lot of the symptoms of schizophrenia, or at least the positive symptoms. Chronic schizophrenia tend to have abnormal brain activity, the people where it comes on slowly. They tend to have low activity in their frontal lobes, and there's a noticeable decline in their brain waves from synchronized neurons firing. Their thalamus fires during hallucinations. Okay, we've talked about this. Your thalamus processes your incoming sensory signals and transmits them to the right cortex. So that's why they're seeing these hallucinations and hearing them, or seeing or feeling or tasting, because your thalamus deals with all of those senses. And your amygdala fires for paranoid schizophrenics. And remember, your amygdala is your fear center. So again, that makes sense. We do know that schizophrenia is not genetic alone. The environment and behavioral influences help determine whether someone will develop the disorder. So it's kind of like a match, if you think about it. A match could start a fire, but in its normal, it's created with that possibility. But if the environment, if it's not struck, if nobody rubs it against something to cause it to actually fire, then it doesn't do anything. Okay. Also, there's thinning of cerebral tissue. More severe brain shrinkage, the more severe the disorder. So the more your cerebral tissue shrinks, the worse the disorder is. We do know your corpus callosum is smaller than normal. Remember, corpus callosum has your nerve connections. It's not, again, inherited like eye color, but your environment could turn on the factors. Okay. So other things we've noticed with schizophrenia: if you had a low birth weight, if your mother had diabetes, when she was having you, if your parents were older in age, if you had oxygen deprived during delivery, or you were starved at some point, you're more likely to develop schizophrenia. We don't know why. These are just things we're noticing. Remember, correlation does not mean causation. We do know that you have a 10% chance of developing schizophrenia if a parent or sibling has schizophrenia. Okay, so let's look at the theories of the cause. Some things we know: there could be a virus during pregnancy. Large number of persons with schizophrenia were born to mothers who had virus in the middle of pregnancy or in areas with flu epidemics. Okay, again, we said 1 in 10 chance of developing. 1 in 2 with identical twins. Stress or difficulties with family could trigger the onset. And low birth weight, short attention span, disruptive, emotional unpredictability, poor relationship with others, etc. All right, now let's talk about dissociative disorders. Okay, dissociative are characterized by a person experiencing a sudden loss of memory or a change in identity. So first you have dissociative identity disorder. It's a person who exhibits 2 or more distinct alternating personalities. It used to be called multiple personality disorder. It is technically and logically called dissociative identity disorder. They are usually nonviolent. This is a highly, highly criticized disorder. Many psychologists think it's fake. It is culturally specific in that we've noticed that it was extremely rare and it's never been seen in Asia. Okay. But we did notice that different brain and physical abilities of personalities. Okay. So like one personality could be left-handed, the other could be right-handed. One might have an allergy that the other one doesn't have. Even visual abilities are different. Okay, so the learning perspective suggests that different personalities is reinforced by anxiety issues. Okay. Psychoanalysis, the Freudian, might say the multiple personalities are some kind of defense mechanism against the anxiety caused by unacceptable impulses. Some people think it's a form of post-traumatic disorder. Might be a natural response to childhood trauma, that kids try to flee or hide inside themselves, and they may create another personality to cope with this. But then the argument becomes, why didn't the kids who survived the Holocaust develop dissociative identity disorder? Okay. All right, guys. I hope you're doing your notes. I hope you're reading. Like I said, once we're done with the notes for this chapter, I will come back and we're going to do a lot of practice with FRQs, because that's what the college board's looking to make your test, okay? I hope you're doing okay. Miss you.